Hi, I'm Annabelle, and I'm going to be talking to you about interventions against suicide in American Indian and Alaska Native youth. So recent data has shown that this population commits suicide more than their peers of other ethnic backgrounds, with the rate being 4 times higher for boys and 11 times higher for girls. Therefore, we need more interventions that address specific risk factors for this population, and research to find out what those risk factors are. One such research study was a 2012 analysis of data from the Oregon Healthy Teens Survey, which looked at risk and protective factors which change a patient's risk for suicide by greater than 2%. Analysis of odds ratios showed that the predictive factors were different between the American Indian youth and the non-Native youth. Specifically, Native youth were more likely to commit suicide if they had emotional problems and did not feel safe at home or at school, and less likely to kill themselves if they had better nutrition and a better sense of health overall, whereas suicide was more associated with trauma and drug use in other teens. They also found that Native youth had on average 2 more risk factors than the non-Native youth, although the risk threshold was higher for Native youth, who had on average 11 risk factors before being statistically more likely to attempt suicide, as compared to the non-Native 9 factors before attempting suicide. So this informs our practice because it shows that Native youth have different needs than their peers, so you may have to modify existing intervention programs to address this. Also, knowing the threshold of risk factors for a suicide attempt is great because it can assist the nurse in knowing if a patient is a mild or severe risk for suicide. Okay, thank you guys very much for watching.